Audio Jungle.
In 2014, United States spent more than $113.5 billion on dental care services. Although there have been many advances in oral health, many Americans still face challenges in accessing oral health care. The burden of oral disease affects the underserved communities the greatest. In response, rather than focusing on a preventative approach and working to eliminate the disease before it becomes more serious and complex, the public healthcare sector's focus has been on addressing oral diseases through treatments and tooth restorations. In order to decrease the national dental care expenditure and improve oral healthcare quality and access, we need to become more proactive, not just reactive. Oral health affects overall health. For example, periodontal disease can cause plaque to build up in the arteries that can result in a heart attack or stroke. Furthermore, research has shown that many systematic diseases such as diabetes, oral cancer, and heart disease have oral manifestations like gum disease. Recent studies have also shown a positive association between periodontal disease and cardiovascular disease. Lack of access to oral health care contributes to the persistent oral health disparities in the United States, especially dental caries, also known as cavities, which is a chronic, infectious, but preventable disease that disproportionately affects the vulnerable and underserved populations. According to the Scientific American, tooth decay is the single most common chronic childhood disease in the United States. 27% of the U.S. children living in poverty have untreated cavities, which can lead to pain, infection, which can then lead to problems with eating, speaking, and learning. One preventative method that has been incredibly successful and effective in preventing and decreasing tooth decay is water fluoridation. Fluoride has been added to the U.S. public drinking supply since the 1940s, and studies have shown the benefits of fluoride in drinking water, leading to better oral health. According to Centers for Disease Control and Prevention, drinking fluoridated water reduces cavities by 25% in children and adults. By preventing cavities, community water fluoridation has shown to save money for families as well as for our healthcare system. The Centers for Disease Control and Prevention listed the community water fluoridation as one of the 10 great public health achievements in the 20th century. Another method that could be extremely beneficial to eradicate oral diseases and promote good oral health is through school programs. School-based oral health education, screenings, assisted referrals, and delivery of oral preventative care services such as fluoride furnishes can provide reliable entry into long-term oral health care. Bringing oral health to schools can also help parents by reducing the need to take time off from work and find transportation. Children who receive care in schools can also become an entry point for others in the family to connect with an oral health care provider and get to know more about the importance of oral health. The combination of education, prevention, and access to care has the potential to nearly eliminate tooth decay in school-age children. Here is Dr. Chris Kajolhead, Medical Director of School-Based Health Centers and Bassett Medical Center, explaining why oral health for children matters.
Dental care is important for children as far as their state of well-being. We know that dental caries and poor dental hygiene has an impact on long-term health. Recent studies have shown that, in fact, the chronic inflammation of some dental problems may have long-lasting effects on the cardiovascular system. Over and above that, having bad teeth is socially just not a good thing. That will affect how they relate to other children and how they relate to people in their environment. There's a huge challenge for families in rural areas that prevents them from accessing both somatic and mental as well as dental health care. Some of these barriers could be breached by putting the care in a school, like we do. Good dental care for kids provides them with a pain-free state that allows them to attend and pay attention and learn in the classroom. One of the issues that's facing our country and our health giver profession today is that we tend to fund for problems. We don't fund for prevention as well. And it would be really nice and very important for kids if we could fund prevention, because that's what we're about in taking care of kids, is preventing the problems that later on are what are covered by funding mechanisms like insurance.
The state of Texas has incorporated oral health into their primary education system. Texas Department of State Health Services Oral Health Program participates in the dental sealant programs in schools. Dental sealants are thin, plastic coatings painted onto the chewing surfaces of premolars and molars, where most decay occurs. This is because the toothbrush may not reach the small depressions and grooves of the teeth. The coating provides a protective shield over the enamel of each tooth and helps prevent cavities. Studies have shown that dental sealants have been extremely effective in preventing cavities and have been preventing over 80% of cavities 2 years after application. However, only 1 in 3 children between the ages 6 to 8 years old have dental sealants. When sealants are available in schools attended by many low-income children, children who are at high risk for cavities will be able to receive preventative treatment and care. The school dental sealant programs often use portable dental equipment to provide sealants to children at little or no cost. The Oral Health Program in Texas provides preventative dental services through school-based clinics with portable equipment. Texas Department of State Health Services Oral Health Program's mission is to promote oral health through leadership in public health practices, policy development, education, and population-based preventative services. Currently, the Oral Health Program at the Department of State Health Services partners with different parts of the state to closely observe and identify the needs of Texas residents. Health professionals in the Oral Health Program provide preventative dental services such as sealants to eligible low-income, underserved, preschool, and school-aged children. The program prioritizes and targets schools with 85% or greater free or reduced lunch program participation and gives free dental services at school. Here is how the Department of State Health Services Oral Health Program organizes and plans a school-based dental clinic. The Oral Health Program also provides school nurses and administrators and teaches them about the preventative dental services, including an oral evaluation of the child's teeth and mouth, dental sealants, and fluoride varnishes, which are applied to stop or reverse early tooth decay.
Let's talk teeth. When a student in your school has a dental problem, it could cause more than pain. It can interfere with learning, lead to absences, and even affect overall health. As your state's oral health program, we're here to help your students get the benefit of preventive oral health services and avoid these problems. The preventive services our program provides, along with our program's support of the dental home concept, may help reduce the incidence of future dental emergencies and the symptoms and consequences that accompany them. The Texas Department of State Health Services Oral Health Program promotes oral health in a variety of ways, including our school-based dental clinics that provide free preventive dental services. Because oral disease affects children in low-income families hardest, we seek to work in schools of high socioeconomic need, rural and/or designated underserved areas. Since your school qualifies, you have the opportunity to host a preventive dental clinic. The latest DSHS Oral Health Program survey found that 25.9% of third-grade public school students had untreated dental decay. National research shows that African American and Hispanic children and those living in families with lower incomes have both more tooth decay and more untreated decay. Our clinics work differently from many other community-based mobile dental programs. Our clinics are part of a statewide program. All services are provided at no charge to the schools or students, without billing to Medicaid or private insurers. Clinics are held on campus during the school day, and the dental team brings portable dental equipment. The clinics are coordinated through one of the 5 oral health program regional teams. A Memorandum of Understanding, MOU, between the school district and the Department of State Health Services outlines the roles and responsibilities of each entity prior to conducting preventive dental services clinics in the district schools. Once your school has scheduled a dental clinic, we send parent information and permission packets for students to take home. A parent or caregiver must sign and return the permission form in order for a child to receive services. The oral health team works with school staff to plan an efficient school clinic that minimizes each child's out-of-classroom time.
Promoting oral health to children at a young age can lead to healthy lifelong habits. School nurses and teachers can promote good oral health in their schools by having posters by the sink in the bathrooms and working with school administrators and parents to provide healthy food and drinks in school vending machines. Also, arranging dental screenings in low-income areas once or twice a year can treat cavities before they become a bigger problem and can help mitigate oral complications in the future and bring healthcare costs down. Limited access to dental care is frequently linked with dental health disparities in underserved areas. Studies have shown that rural residents have less access to dental care and have higher rates of tooth decay and permanent tooth loss. In order to improve and promote oral health initiatives in rural communities as well as oral health care delivery system in the United States, it is important to understand the status of oral health among different population groups and implement strategies to help change public's and policymakers' perception of oral health. By bringing oral health care to the most vulnerable populations and ages in the country who have the least access to such care, we will be able to catch and prevent serious oral complications earlier on. Expanding school-based dental clinics to help develop healthy behaviors early on and focusing on preventative services by investing in oral health education can help mitigate oral complications greatly. Focusing on preventive measures can help decrease overall healthcare spending in the U.S. and bring healthier smiles to everyone.